You're a doctor, right?
Take 3.
Take 3. Hi, everyone, and welcome to You're a Doctor, Right? By Sonya Bhole. I'm a breast-trained radiologist here to answer all of your most common medical questions. And I'm so excited because our guest today is Dr. Courtney Weems, a board-certified pediatrician. And I am so excited because I could literally talk to her all night about all of these questions, but we're trying to make sure that we're covering the most common questions, starting with infants and newborns to childhood and adolescence, to toddlers. We're going to touch it all, but probably in 2-part series. Before we get started on our episode today, I want to remind all listeners that the content of this podcast is for informational purposes only and does not constitute formal medical advice. Do not delay in seeking professional medical care because of something that you have heard in this podcast. If you have any questions regarding your own health, please talk personally to a doctor or other healthcare professionals. Relying solely on the information provided in this podcast should be done so at your own risk. Now that we're done with the paperwork, let's get started on this episode today. The first part, I really want to touch on newborns and infants. And I know as a first-time mom 7 years ago, the 3 things I cared about most were sleep, poop, and food. Am I crazy, or is this the common theme?
No, that is it. You've hit on the 3 probably most common things.
Okay. Tell me, where do we start? Maybe do we start with feeding?
Yeah, let's start with feeding. Let's start with feeding.
The baby comes out and they literally put your baby in a car seat. Yeah. And then you drive off with this baby.
Exactly.
There's like no handbook given. You're all of a sudden a parent.
I know.
And I'm like, what do I do? How do I feed this baby?
And you're like, breastfeeding is the most natural thing ever.
It's going to be so easy. This baby's going to be on my breast and I'm going to feed. And as a breast-trained radiologist, I look at breasts all day.
Yeah.
I was like, let's see what these babies can do. Yep. And they did nothing for me. So, and there was guilt and anxiety and I'm supposed to be using these. And it's not working. And is my baby starving?
Yeah.
Give us a skinny.
All right. I think it's such a difficult topic, but I think going in, try to have some idea of what you would like to accomplish. Would you like to breastfeed? Would you like to formula feed? Would you like to do a combination of both? Because in my opinion, and the opinion of the AAP, it's a fed baby is best. So breast is best is an older, kind of thought. I mean, of course, we love breastfeeding. We love breast milk. It's wonderful. But if you're not able to do it, I do not care. I want you to feed your baby.
Yes. Okay.
So, certainly go into it with whatever sort of thoughts you want to, go into it with, which is just pick something and have a backup of formula if you can. And then there's lots of different ways to do it. But I think the most important thing is to not, like you said before, not have any shame, not have any sort of guilt about not being able to breastfeed if that's something that happens with you.
And how do you know if your baby's starving?
I
remember my baby, our first baby was tiny. He was a 5-pounder. But then he was tinier and tinier and tinier. And finally we had to take him in. We had to get him weighed. And we had a lactational specialist. And finally my husband was like, okay, you can breastfeed whatever you want to breastfeed, but I'm giving this baby formula because this baby needs calories. When do we pull the plug on it? When do you start saying you actually have to give this baby formula? Is there a number?
Yeah. So basically the baby comes out with a birth weight, right? Okay. And we take that number, whatever the birth weight is. And if they lose more than 10% of that number, 10%. Then we're going to start supplementing, whether that be from pumped breast milk or if that's formula, it's formula. But again, a fed baby is a happy baby. Yes. So that's what we want to focus on. We want to focus on that time being bonding time for you two. And it doesn't have to just be from breastfeeding.
Right.
You can do it from breastfeeding or you can do it from skin to skin or other things.
Because I feel like all the times I spent trying to breastfeed my child was not relaxing.
Yeah, it was anxiety provoking, right?
It was anxiety provoking for my baby probably and me.
Yes.
And like you said, the healthiest babies are fed babies and they probably sleep the best, right? Which takes me to sleep. Please tell me about sleep. I was total mess.
Yes.
I'm so happy I'm not having any more kids because I could not figure out sleeping. I could not figure out sleep training.
Sleeping is tough.
When do you start sleep training? Fair. When is it appropriate?
Yeah. Great question.
What do we do? There's so many resources out there. It's overwhelming.
It is overwhelming. First of all, I want to say that from 0 to 2 months, it's survival mode. Do whatever you got to do to get through it. Okay. Put your baby on their back to sleep. Yes. Use a pacifier. It reduces the SIDS risk. But anything else, whatever you have to do to survive. At 2 months is the
mode.
Exactly.
Yeah.
2 months is the earliest you can really go and start making those sleep associations. So a baby really will after the 2-month mark, start to kind of get into a routine and understand a routine if you start putting one in place.
Okay.
So at 2 months, I have my patients start doing like a bath, a book, a bottle,
Kind of
or
like that
breastfeeding.
wind down kind of situation.
Exactly.
Okay.
And then I have them put the baby to bed on their back, awake or partially asleep, so very drowsy.
Okay. So I always failed in that. I would put my baby down to sleep. I would rock them in a chair, and then they would go to sleep.
Yep.
Yeah. Okay. Wrong.
Well, you can do that certainly, and if that gets you the 5 hours or 7 hours you might
Whatever you
want,
need.
do it. But at around 4 months, it becomes too stimulating, and they're not able to do it that way. And so then it's sort of a habit you have to break, which makes it really tough.
So it's harder to break the habits. It's better to put them in. At
Exactly. Exactly.
Speaking of like weight and how much your babies weigh, is there a weight time
Yeah.
that they, okay.
Yeah.
What is that?
Around 12 pounds is
Okay.
usually like the earliest that they're, able to kind of make it for a good stretch of time. And
Okay.
technically it's 12 pounds, 12 hours, but let's not get too excited because it doesn't always happen for everyone that way. But that's the goal.
Okay.
So we put them down somewhere around 7. They sleep till 7. That would be an amazing feat.
Amazing.
Yes. So that's sort of our goal. I think it's important that all these sleep resources really are kind of trying to get you to do one thing, which is to teach your baby how to self-soothe.
Yeah.
Now, whether it's like a full-on like cry it out on your own, or there's like different methods of like making it a little more gentle, it sort of relies on the same principles.
It's so hard to hear your baby cry.
It's awful.
What advice do you have to moms out there who's sitting in their room just anxiety riven?
Oh, I know.
There is like their baby is crying.
Yes.
What do we do?
Well, number one, rely on your partner.
Yeah.
Okay. So if it's too hard for you, know that it's too hard.
Great advice.
Go get in the shower. Go take a walk around the block.
Yes.
It doesn't take that long, honestly. So just get out of the situation, because that's what I had to do.
Yeah,
honestly.
I can hear it. It was awful.
It's like just so nerve, wrenching. So I think have your partner, rely on your partner to help you, but it's really putting your baby to bed somewhat awake and then allowing them to self-soothe them to bed. Okay. So you can do it in so many different ways.
How do they self-soothe? What do they do?
They move their heads back and forth. So you'll see that they lose their hair.
Why, yes, I remember I was like, oh my gosh, my baby is going bald, but that's normal. That's a good thing.
It's actually a good thing. So a baby who can self-soothe like this is ready to start sleep training, is ready
to know.
Yeah, is ready to start relying on their instincts. And then other things are like hands in the mouth, sucking on their fingers, things like that. Okay. And I think there's so much stigma for a lot of people about like kind of sort of abandoning their baby, and it's not that.
You're teaching them how. Our end goal in this whole thing is teaching them how to be a functional adult, and it starts here.
It really does. It's the first gift you'll give them.
Yeah, that's great.
Yeah, they can finally rely. They can rely and learn that they are safe in whatever environment that they're in.
I love that.
Yeah,
that's a great way. So everyone listening, you're not torturing your baby. You're teaching them how to feel safe in their environment at home, which is Dr. Courtney Weems says is the best gift you can give your baby. I think that's really important advice.
It really is.
Okay, I want to pivot to my third neurotic. The third thing I was most neurotic about when I was a new mom, which is poop. Give us a scoop on poop.
It really is. Like, honestly, the number one question, I would say, is this poop normal? I get so many pictures, so many questions.
Poop? Yes. It looks so abnormal.
I know. Okay. And it comes out from the very beginning, very abnormal looking. So it's like this black tarry situation. And then it turns to like a yellow seedy situation. And then it's brown or green.
A lot of situations.
Yes, lots of situations.
Situationships
going on in that diaper. But any like yellow, brown, green, any variation of any of those are totally safe.
Normal?
Yes. Okay. And everything, like what you eat, is also going to change, the color of the poop. Yeah. So know that, that's going to make alterations in the color and the consistency. Yeah. Okay. And also when we start solids, that's going to change the consistency and the color. Okay. Yeah. So we'll have times where, there's mucus, and that's okay every once in a while. We just don't want it consistently. So mucus is a red flag. Okay. But that's if you're seeing it frequently. And then the 3 things that you're looking out for: red, white, and black.
Okay. Like a poisonous snake.
Like a poisonous snake. Yes.
Okay. This
yes.
is really important.
Like a poisonous
so like
snake.
a poisonous snake.
Yep. So red,
black,
and
white.
white. Yep. Exactly. So red means there's active blood.
Okay.
So we don't want that.
Nope. Don't want that.
White means that there's something going on with the biliary system. So gallbladder, liver, something going on with the ducts. The black is like an upper GI sort of bleeding situation. So that is something we obviously want to know about right away.
Okay. Okay. So red, black, and white, things we need to know about. Okay. In the last few minutes, like I said, I could literally talk to you all day. I really want to touch on vaccines.
Oh, yes.
Particularly the measles vaccine.
Okay.
What are the most common questions you're getting about vaccines? What do we need to know about the measles vaccine?
Sure.
At a cocktail party on Saturday night, I had a friend ask me, I'm going to Miami on Saturday. My kid hasn't gotten their first measles vaccine. Do I get it a few days before? Is there any efficacy in that? What do we need to know about the measles vaccine?
Great questions.
And vaccines in general.
Yes. Number one, I think vaccines in general are wonderful.
Yes.
It was the greatest accomplishment of the 20th century was eradicating polio from the world.
Yeah.
Unfortunately, now since we have taken a step back and we are no longer in that situation, but vaccines are safe. They are scientifically, they work. They are scientifically and evidence-based, and safety protocols are all in place to make sure that your kids should get these get them at the right times with the right number of antigens for their immune system and the right, the whole package has to be there. And it is there based off of all of the
years and years and years of research.
So, even since
I was in medical school, the vaccination, I remember we memorized all those charts.
Yeah,
they
not
haven't
changed. No, it hasn't changed.
And that and it hadn't changed 30 years before that either.
Exactly.
Right?
So there is
a reason,
well documented, safe
longevity studies.
Yes, exactly. The measles vaccine in particular seems to really scare people. There used to be an association like in the public, like it gives kids autism. We now know that there's zero correlation between
That's
the
a
MMR.
really important point. I'm so happy you're touching on that. So zero correlation.
There's no correlation between the MMR vaccine and the MMR and autism. A lot of the problem with the autism question is that the timing of vaccines happens around the timing of
diagnose, right?
Exactly. And now we have a spectrum, right? So we're diagnosing kids much more frequently than we used to.
Okay.
So, it used to be like 1 in 100, now we're 1 in 36, but now you're talking about an entire spectrum versus just the severe cases.
Yes.
Yeah. But anyways, that has nothing to do with the MMR vaccines. That was a complete side note.
Well, it was a great side note. It was actually on my notes to ask you about, so I'm so glad you digressed on that.
So for the MMR vaccine, I think people get scared because it's a live attenuated vaccine. So what does that mean?
What does that mean? It sounds scary.
It does sound scary.
Even as a doctor, it sounds really scary.
Yes. And obviously we're talking about our most prized possession, our baby.
Yes.
A live attenuated vaccine is just a very, very weakened strain of the virus that cannot actually induce the illness.
Okay.
But it can create that immune response. And it's an amazing vaccine because after just 2 doses at 1 and at 4, you're about 97% protected.
Wow.
That's
really
amazing.
97. Okay.
Yes. And with the side effects of the actual measles virus, trust me.
Those side effects?
Oh, they're terrible. So, you're talking about terrible pneumonia, skin infections, clotting disorders. Big one is encephalitis, which is swelling of the brain. Like really, really, really terrible side effects.
So what are the side effects of the actual measles vaccine that scare people?
I think that's a great question. I think that the most scary side effect is this febrile seizure.
Okay.
So it can cause fevers in kids.
Seizures can be scary.
Yes, certainly very scary to see your kid have a seizure.
Yes.
Completely understand that. I'm not writing that off in any way. The incidence is actually very low.
Okay.
It's about 3 in 10,000 kids.
That's really low.
It's very low.
Okay.
But even so, even if that were to happen to you, as horrible as that would be,
what do you do?
You don't do anything.
Okay.
It's supportive care. You just make sure that they're safe. You make sure that they're laying in a sort of somewhat comfortable position, that they're not biting down on something or not, able to fall.
Yes.
And you wait till that's over, and then you treat them with Tylenol, Motrin, and a bath.
So those side effects sound a lot better than the side effects from potentially gaining measles.
Yes.
Last question, because I know you're so busy and we appreciate your time so much. What would you have told that friend of mine that asked about the measles vaccine before going to Miami. I told them to talk to their pediatrician.
Great. That's great.
Because I don't know.
That's actually
What
good.
is the answer I could have said?
So I think if you're going to an area that has an active outbreak, it makes sense to get the vaccine early. You can get it as early as 6 months.
Okay.
But you still have to repeat it at 1 year and at 4 years.
Okay.
So even getting it early, it doesn't give you any benefit except for that short period of time.
So there is
where
some short-term benefit.
Yes, for the immunity.
But you have to repeat it.
Right. But you can, yeah, exactly. You're not going to get to that 97% without the 1 and the 4 year booster. So I would probably say you don't really need it at this point because there are pockets in the US that are having little outbreaks, but nothing too wild, and especially that one in Texas that's going on it's a smaller area it's a contained area. Exactly. But a few summers ago in Italy, they were having a really bad outbreak. And so I recommended that anybody going to Italy to that particular region should get it before they go. Yeah.
Okay. That's really helpful. I wish I talked to you before I went to a dinner party Saturday. These are the questions. You're a doctor, right? What do you think about the measles vaccination?
Exactly.
I'm like, I don't know. All right. I want to summarize what we've talked about really quickly. So the thought of breast is best. That's wonderful if you can breastfeed, but really a fed baby is best. A fed baby is healthiest. And so however that baby gets fed, whether it's breast milk, pumped milk, formula, the baby needs nutrition.
Exactly.
Try and take that stress off yourself.
Exactly.
Number 2, sleeping. Oh my gosh, we need it. We can go crazy without it, but don't even try to sleep train until 2 months, 12 pounds.
12 pounds.
Poop, poisonous snake. We worry about red, white, and black poop. Anything else, all colors, all consistencies, totally fine. All other situations in the diaper, totally fine. And finally, get your vaccinations, particularly the hot topic of the measles vaccinations. Get the vaccination, even if the sound of a live attenuated virus vaccination scares you. The side effects are really, really treatable and low. The side effects of measles can be really catastrophic.
Exactly.
Dr. Courtney Weems, thank you so much for being here.